Let's just go ahead and confirm what we got. You have 7 years active, and you're currently in the reserves in the Navy, right?
Yes.
Okay, so what year did you get out of active?
Last year, 2023.
All right. Okay. And all right, and you have a deployment in Southwest Asia in Fifth Fleet.
Yeah, 50.
I'm gonna assume you were in like the Red Sea or the Gulf of Aden or the Gulf of Oman. Does that sound right?
So, yeah, the Gulf of Aden and Persian Gulf. We
Okay,
never went
perfect.
to the Red Sea. Yeah.
That means you rate the PACT Act presumptives, which we'll cover on later on. But that's solid. And then looking at your service-connected disabilities, I have you at 78, which is rounded to 80. You have a bilateral factor in there too. Your left knee's rated at 0 and 10 for instability and flexion.
Yeah.
Right knee at 50.
Yeah.
Is that correct?
Yes.
Okay. Can you tell me what happened with the right knee?
It's just I honestly don't know what made it start hurting, but when I was on deployment, that's when my knees and my back started hurting. I just kind of assume it's just all the stairs going up 9 decks every day, multiple times a day. It
It could
just
be, especially on the ship stairs are pretty stupid. So okay.
yeah, yeah. So I just assumed it was that, and then it's just like a strain every time. Like it feels inflamed all the time. When I walk, I feel it. If I run, it gets bad. But yeah, it's
Okay.
just
All right. Your mental health is at 30. We have your back at 10, and then headaches at 10, and hypertension at 0. Is there anything else we're missing?
no.
All right. And then you have a 1 denial for dry eye syndrome, which is, I wouldn't even sweat that, to be honest with you. Are there any
Okay.
other denials?
No, that was it.
Okay. So how this is going to work, we're going to look at increases, secondaries. We're going to skip your denial for dry eye syndrome. I already read your decision letter. We'll talk about new conditions. And then PACT Act presumptives. New conditions are really going to come into play for you, I'm guessing, because you just got out. So we'll kind of go through everything that you should have claimed the first time around, assuming that you didn't, right? You very well could be properly rated. We don't know yet. So looking at your knees, I can tell you right now, I'm not going to recommend even touching your knees for any reason. A 50% for a right knee and a 2 rated conditions for your left knee is pretty solid.
Yeah.
So we're going to skip those. Mental health is going to be a big one. We'll do that one last. Lumbar strain. So you're service connected for that. That's good. Okay. And I know you just had a baby. Can you talk to me about outside of your pregnancy, right? Talk to me about the range of motion in your back. Like if you drop your phone, can you bend over without bending your knees to pick it up? Like what does your range of motion look like?
Um, my it'll start hurting as soon as I just bend down a little bit. Like I can bend down, it just hurts as I go down. If that makes
Okay.
sense. Yeah.
Nope. Totally makes sense.
Okay. Yeah, and it's mostly on the right side, but I know you said don't speak about it like during pregnancy, but after pregnancy, I feel like it got worse.
Yeah,
Yeah.
yeah. I would assume that's the case.
Yeah.
So you already service connected, okay? Your range of motion does sound bad. I know it sounds like you have range of motion, but there's pain there.
Yeah.
Just based on what you said, all right, I'm going to recommend that you do submit an increase for your lower back. You're going to
Okay.
have another CMP exam for that. Just exactly what you just said. Communicate with that with your examiner, saying, "Hey,
Yeah.
you bend over and say, I'm starting to feel pain right now." Bend a little further and say, "This is where it really, really freaking hurts," and just express that to the examiner. Okay.
Yeah.
There's really no good way to do that other than let the examiner know everything. But I do think, based on what you said, lumbar strain would be a pretty solid increase.
Mhm.
Uh, and then we're going to jump to secondaries just because we're on lumbar strain. Do your legs ever go numb or tingle or fall asleep? Like when you sit down or use the restroom or stand up too long? What is
Um,
how like the numbness in your legs? What does that look like?
I don't think I get numbness. Now I'm trying to think about any time I have numbness, but I don't think I get that yet.
Okay,
Hopefully never. Yeah.
no big deal. If that ever changes, okay,
Mhm.
just know that you could probably claim radiculopathy, which is nerve damage, but you'll need a diagnosis for that. So
Yeah.
just keep that in the back of your mind. All right.
Okay.
Okay, so that's out. Let's talk about tension headaches. Can you talk to me about how bad your headaches are?
I get them. Well, I started getting Botox again, so it's been getting some relief from that. But I'll normally get them like once a week, at
Okay,
least.
and what's the severity like? Let's say you had a
Um,
headache right now. What's your routine?
it would when I get headaches, it starts to hurt my eyes. Like I get like I feel like my eye is getting squeezed into my jaw starts hurting like one side of my face. It's always just like one side.
Okay. Do your how often do you get Botox treatments in your head?
Um, I just started again 2 months ago. I do it when I can
Are you
afford it.
also are you also on medication?
I'll take Tylenol and Motrin sometimes. Or I'll
Okay.
drink some coffee. I know caffeine helps with it, so I'll do that sometimes.
I think with Botox, and you get them once a week.
No, like
Well,
maybe once
not the
every three,
Botox
4.
treatment, but the headaches. You get headaches once a
Yeah,
week. Okay.
about.
I'm gonna recommend. I'm also gonna assume you haven't seen your. Well, hold on. Talk to me about your primary care visits with your doctor for your headaches.
What? Can you repeat that again?
Can you talk to me about your primary care appointments for your headaches?
Appointment? I haven't had an appointment for it in a while. I mean, the last time I brought it up to my doctor was when I was pregnant. I don't know if it was this pregnancy or actual just me always having headaches, and also lights actually make it bad. But I started taking magnesium for a while to help with it. That's what the doctor recommended. But
Mm-hmm.
yeah, that's the one thing about light, really bright lights. It triggers my headaches.
Yep.
And I work on computers, and I worked on computers, or my IS Intel specialist,
Yep.
so
Yep.
like use computers all the time.
Okay. That. There's that. Okay. So based off of once per week, I'm gonna recommend headaches are an increase. Now, go ahead and submit your intent to file. Okay, that's most important. I'll put that
Okay.
up at the top. Submit intent to file. You can do that online, right? You can do it right after this meeting. It takes like 5 minutes to do. It's super easy, and I'll go ahead and link a video for you to do
Okay.
that. Let me do that real quick before I forget. And then we'll talk about your symptoms for migraine. So you have them frequently, right? You're on treatment for Botox. If you treatment for Botox, I'd assume you'd be on medication. Um, so I do think you rate the increase at least to 30%. That's what it sounds like off the bat.
Okay.
The problem with migraines is it's very easy for the VA to either deny and the increase or lower it. And so
Yeah.
that is why we need evidence, because you can lean back on evidence, can't really lean back on anything else. Okay.
Yeah. So that
But
would probably
with your
doctor for that.
yes,
Okay.
absolutely. So when I say, speak with your primary care, it's really one healthcare always is first, but it's also medical evidence. Okay. And so
Yeah.
with your headaches, I want you to submit new evidence from primary care, and I'm going to assume you're seeing the VA.
No, I go to my um I go to Kaiser.
Private?
I go to private PPO. Yeah.
Okay. All right. So definitely submit that evidence with your headache increase. And you don't when you do the intent to file, you don't have to submit everything. It kind of just gives you the day. You have a whole year to figure it out.
Oh. Okay.
So do the intent to file only, and then once you get the evidence, start uploading that with your claim. So new evidence from primary care, and then a personal statement. And that personal statement is going to include frequency, severity of symptoms, treatment plan.
Okay.
And for you, the treatment plan is Botox injections. Okay. I'm also going to link a essentially what I just said, but way more in depth video on migraine increases, because evidence is absolutely key when it comes to migraines. Okay.
Okay.
I'll put that there for you. Bam. Lumbar strain increase. I'll link the back video, but it's going to be range of motion for you. You're already service connected. That's the good part.
Yeah.
I'll go ahead and link that just in case, though. Okay, so those are increases. Well, we have hypertension. Are you on medication for hypertension?
No. What happened with that is before I got out, every time I went to the doctor, my blood pressure was elevated, but they were thinking about putting me on medication, but I got out, so I never continued seeing the doctor about it. And then I was considered high risk while pregnant, but I don't think that matters, right? I haven't checked my blood pressure in a while, so.
Were you were you had a high risk for preeclampsia, but never had really high blood pressure while you were pregnant?
Yeah, exactly.
Okay. All right, cool. Healthcare wise, definitely keep tabs on hypertension. That could be something serious or nothing at all. But based on what you said, I'm not going to recommend an increase for that. Hypertension, the most common rating is 0% anyway, so you're right in line with what's considered average, I guess. I wouldn't say normal.
Yeah.
Okay, so that's increases. We talked about secondaries for lumbar strain. Let's talk about mental health now, okay? When I look at your percentages, this is what you look like right here. This is Hill and Cotton's website. Here's where you're at. So we take the 30% away for mental health and give you a 50. That gives you 83, which doesn't do much because you're still at 80%. If you're at 70, that puts you at 89. All right. So an increase will still definitely help. Same thing with your tension headaches. I do think you're describing their 30%. That's what I would rate you at based on our conversation. So that alone will put you at 81. And then if you add the mental health increase, that puts you at 90. And then mental health at 70 puts you at 92. Right. So there's definitely potential there. It just depends on what your evidence says. So with that being said, let's talk about mental health. All right. 30% is, especially for our generation of veterans, the Gulf War era, meaning all the way from 90s to post 9/11. Mental health is extremely common in the top 3 claims, and I'm going to describe what 70% could look like. All right.
Okay.
And 50% is essentially the same, just less severe. Side note, mental health is going to change at some point, and when that happens, it's going to be easier to get the increase. So also keep that in mind too, but that's neither here or there right now. So for 70%, there's 3 main symptoms. There's others, but the 3 main themes that I see in 70% for mental health is 1, depressive episodes and anxiety and panic attacks, right? So a depressive episode would look something like, you have all this stuff to do, but you're depressed, so you don't do it, but then nothing gets done, so it makes you more depressed, and you kind of like melt in your couch, and then nothing gets done, and it's just a constant cycle of like a depressive episode, right?
Yeah.
That's what depression looks like in a lot of cases. And then I want you to think about panic attacks. So panic attacks on one end of the spectrum, it's your whole chest cavity move, and you can like feel your heart about to explode. That's a panic attack. It's also, whenever you like I'm in my car right now before work, and if I'm freaking out before I'm going into work, that would also be a panic attack. So there's two ends of the spectrum there. You can figure out where you're at, if at all, on those two. That's one symptom. The next one is much, much larger. It's like your ability to maintain effective relationships. So, like maybe you struggle emotionally to connect with your children, right? Or your partner, or your family or friends. If that's you, that's something that needs to be discussed. Not with me right now,
Yeah.
just with your primary care or your referred care if you're seeing a psychologist or psychiatrist, whatever that looks like for you. And then the third symptom is irritability, right? If you get mad really, really easy, like ticked off, think of like a very, very old, like senile Vietnam type veteran who's just pissed off all the time. That would
Yeah.
be like the high end of the irritable spectrum. So those are your main three, okay? Not saying there aren't others. Those are just the biggest three that I've seen a lot. And if that is you, then I would recommend an increase. Even if it's not as severe, those will
Mhm.
still fall into 50% criteria. So my question for you, and a yes or no will suffice. Do you want to push for a mental health increase or not?
Yeah.
Okay. All right. Now for that one, I'm absolutely going to recommend a personal statement. Okay.
Okay.
Speaking on MH 30% symptoms. I'm going to link another video for that. But I really need you to speak with your primary care
Okay.
on your mental health. Are you seeing a mental health specialist regularly at all?
I stopped while I was pregnant because my what's it called? My insurance changed, so I had to drop my counselor, my therapist.
Oh, because you're using private. Okay, okay.
Yeah, I was using TRICARE and then
So
I switched to private. But when I was pregnant, they gave me Lexapro to help.
okay. So side note, as I don't know what you know about VA ratings, all your healthcare is free at the VA.
Yeah.
Okay, so if that's an option, totally up to you. If you use private, and I'm actually going to put this in all caps in bold,
Mhm.
you have to upload your records to the VA. The VA doesn't have access to those records,
Okay.
okay? If you
Well,
use private insurance for healthcare, upload private healthcare records with each claim. I'm sorry, what?
actually I do have TRICARE because of can't say names.
Yeah, no, it's fine.
Okay.
So TRICARE, not VA, okay?
Okay.
Like a dependent status is something completely different.
Oh,
VA
okay,
healthcare
okay.
is VA healthcare, right? So don't.
Yeah.
But if you want to go that route, I would still treat that like private and
Private.
just
Okay.
just grab those records, okay? Um, just in case, there's no harm, no foul in uploading medical records. Okay.
Yeah.
Mental
Sorry, she's
health.
just getting sleepy.
Oh, you're totally cool.
Okay.
Okay. That increases in secondaries. I read your decision letter for dry eye. Don't sweat it. It's
Yeah.
it's it's not something to fight anyways, in my opinion. Now, your new conditions for you, I think this applies more so for you. Is there anything in the Navy that you can remember being seen for or was hurt by, or anything that happened that is not on this list right here? So
Any?
for like your health assessments, your pre-deployment health assessment, your post-deployment health assessments, anything that was discussed during those three, or your exit exam, would come in clutch right now, for you.
I know I think in my exit exam, I gotta look at it again. But one thing I mentioned was my jaw. It's always been a
Okay.
problem before I even joined, but it got like worse with the headaches. So, um, what
I'm gonna
else?
put jaw condition as a blanket statement here. Okay.
Okay.
If you're gonna need a current diagnosis, and so speak to your healthcare team about your jaw. Whatever that
Mhm.
condition is what you claim. Okay.
All right.
So it could be TMJ, bruxism, whatever's happening up there.
Mhm.
Go ahead and speak to them. But that'll be a new condition. Is there
Yeah.
anything else? So I'm thinking about your back and your hips. I'm sorry, your knee mainly before anything else, because 50%
Yeah.
is wild for a knee. I'm thinking what that makes me think is that you have a foot condition, if not both. You might have a hip condition. I'm really surprised you don't have nerve damage in your legs. But if you don't, you don't. That's cool.
Yeah. I mean, it's
Maybe
getting
like some
worse.
cervical strain, like neck. I'm sorry. Go ahead.
No, I was just like my knee and my back. They do feel worse ever since I had the baby. I feel like it's just like more pressure now. But uh,
Yeah, the thing about your knee, your knee is always gonna hurt, especially
yeah.
if it's rated that high. Um, that's just there's really no other way to cut that cake. That
Yeah.
sucks.
I did mention like my first CMP exam to the doctor. Because when she was checking my back, she asked if I ever had like any hip um pain or injury, and I just mentioned like we used to do beach runs when I was like in A&C school, and that started hurting my hips, but I never went to the doctor for that. But it was like the only thing I could think of.
Would you be
Yeah.
able to like if your hips were checked out right now, or do you think you have a diagnosis?
No, I don't think so.
Okay.
I don't feel
If
like
that changes, I'm gonna put that on the list here. If that
yeah.
changes, then you submit a new condition. Just left
Okay.
hip, right hip, whatever you got going on. Okay.
Yeah.
All right. So that's new conditions. Now I want to talk about PACT Act presumptives because the Fifth Fleet
Yeah.
AOR is essentially all of Southwest Asia. So, well, the ocean of Southwest Asia, which
Hmm.
counts towards PACT Act. So let me pull up this list up here. Okay. So these are your Southwest Asia right here. Okay. There's your cancers. I'm gonna assume you don't have any cancers. Okay.
No. Yeah.
All right, that's good news. Let's scroll down. So the most common that I've seen in PACT Act era veterans or your post 9/11 is asthma, bronchitis, rhinitis, and sinusitis. Do you have any of those? Like, do you wake up with a stuffy nose? Are you constantly blowing your nose? Like, what does your allergies look like?
Um, I don't think I have any of those.
Okay, and do you have asthma at all? Do
No.
you like wheeze? All right.
No.
Um. Okay. Other than that, that is it. Oh, the last thing, because Southwest Asia, just to cover all of our avenues here. Do you
Mm-hmm.
have bathroom issues?
When my anxiety is high, but not if my anxiety is okay, then I don't have bathroom issues.
How often are we? And I know this is really weird. Um, let's say you're going number 2 per week. How many times per week are we talking about?
Um,
Like
like one day.
13 once a day?
Yeah, using the
If you
bathroom. Yeah.
are if you're ever diagnosed, I'm gonna put that on our list too for primary care. If you're ever diagnosed with IBS, right? Or like chronic diarrhea, anything that involves all of that stuff, then submit the claim. All right.
Okay. I just thought of one thing. I
Yep.
did a sleep test after when I did my CMP. they ordered a sleep apnea test for me to do at home, and I passed it. But yeah, I was told I've been snoring really loud lately. I don't know if that's got to do with anything.
It can be, but without the, it was an at-home sleep study. So it's my opinion. At-home sleep studies are trash.
Yeah.
If you do believe you have sleep apnea, you're going to need a diagnosis, and it's going to be very, very difficult to even claim that with a negative test result, right? Obviously.
Okay.
Now, you all of a sudden you go get a sleep apnea test and you are diagnosed, that's a different story. Okay.
Okay.
But the same thing applies here. If I'm just gonna put, if you believe you have sleep apnea, get diagnosed with new sleep study. But you're absolutely going to have a diagnosis, especially after a failed exam or having a sleep study. Not being diagnosed with sleep apnea would be the best way to say that. Okay, so other than that, if you don't have anything else, that's pretty much what we have going on. All right. You submit the intent to file. I'm going to link the mental health video here in a second. I think your increase for your back is pretty probable based on how you described it.
Yeah.
Your headaches, in my opinion, rate 30%, but you're going to have evidence. Your mental health, we spoke on 70% symptoms. I'm just going to assume that's a 50. Then your jaw condition, which we don't really know yet. But the dental conditions are generally going to be 0% anyways. And so I want you to see what I am envisioning, right? So we forgot your back in here. Did we forget your back? Yeah, there we go. Okay, now your back's here. So let's say your back goes to 20. All right, that's at 80. Let's say your headaches go to 30. You're at 85, and your mental health goes to 50. That puts you at 90 flat. If your mental health goes to 70, that puts you at 94. Super, super, super close. Okay.
Yeah.
But I do believe you could definitely reach 90, no problem, as long as you have the evidence. As far as 100% goes, it really depends on the severity of your headaches. I want you to watch that video because it's going to go into other symptoms. And so a lot of times, especially with newer veterans, you don't even understand what's happening. Okay. And so you might have difficulty articulating what the heck's actually going on. And so I want you to watch those because it's going to talk about symptoms. So that way you can actually understand what is happening inside your body. Okay. And at the end of the day, if you're properly rated at 90, that's cool. If you're properly rated at 100, that's even better, right? The goal is just to be properly rated. And then with all of your primary care stuff, you're going to need evidence for migraines. If your legs aren't going numb yet, I think they will soon. Okay, so just keep tabs on that. Same thing with hypertension. You need evidence for mental health. You need a diagnosis for your jaws. If you have a hip diagnosis, claim that. And then same thing with IBS. And then the sleep study, it seems like a long shot based on what you said. Okay, but if you're diagnosed, then that changes the game. Do you have any questions for me at all?
No, I appreciate your time though.
All right, yeah, no worries. And you can always email me, and I'll definitely hit you back up. Okay.
All right, sounds good.